Hello everyone, my name is Ana.S and today I have a question for you. Does anyone know what percentage of the United States population is uninsured? Many people came to the United States to pursue their American dream, but the reality is completely different with what they thought, especially in the healthcare system. Duggan and Gruber said 40% of the people in terminal stage of their illness said they are really worried about how they have to pay for their medical bills since they do not have any insurance. Today, I want to convince you that the healthcare system is one of the major concern in our society and it needs more attention from the government and the people. Today I want to talk about the cost and inequality service in the medical field and how this unequal allocation of the power and resource in the society can cause the problem for accessing the medical care. First of all, I want to talk about the healthcare service, which is not affordable for everyone, and it creates an unequal situation between different types of social classes. If I want to talk about my experience, I remember 5 years ago, my mom came to the United States and she had a really bad back pain. She ignored it for like 3 months because she didn't have any medical insurance. After 3 months, her situation got worse. Her leg got numb, and we didn't have any choice to call 911 because we couldn't move her anymore. Even my mom's situation was really bad. We were really worried about her cost, hospital cost, because no one knows how much should be the total cost after she got discharged and what percentage did her insurance cover and how much she had to pay out of pocket. So I think it's better that the hospital properly inform the patient about the cost to everything be clear and the patient doesn't have any further consequences, because my mom had a lot of fight with her insurance because the insurance just covered a small portion of the cost and paid for some specific medicine, not for all of those. Cousin said America is among the developed countries and it has an advanced healthcare system. However, it shows the low performance as 47 million of the people do not have a healthcare coverage. This low performance is because the healthcare service and the prescription drugs cost is really expensive for them and it drives the people away from accessing the medical care. Although the United States has advanced technology, people cannot afford it because it's so expensive for them. Despite the United States' claim all men are created equal, in the reality, the level of education, citizen status, social, economic, and the color are a critical parameter that can marginalize the people from each other. Health coverage of education said there are 25% lawful immigrant, 9% citizen, and 46% undocumented immigrants in the United States that are uninsured. So the statistics demonstrate although the people with low socioeconomic background cannot use the benefit of insurance for themselves and their family member, it also the cost is not affordable for many American citizens as 9% of the citizen people are uninsured. So we're done talking about the healthcare problem and we want to dig deeper to what is the cause of this problem. The root of this gap between the different social class in the medical service is related to unequal allocation of the power and resource in the society. Gaffney said the neoliberal policies influenced the public health care to become more privatized and the hospital just think about their own benefits and profit instead of giving the good quality of the service for the all of the patient equal. So the in this situation, the rich people that are in power can allow to access the high quality of medical service, and they can diagnose their disease early to treat. And the poor people should put themselves down to get a certain amount of income to be qualified for the affordable healthcare. So the neoliberalism has a negative effect on the healthcare system because it creates an unequal situation between different type of social classes. Since most of the funds are controlled by the private companies in the United States, as we all know, the private insurance firm offer the medical cover depend on the ability to pay the premium, and it's not equal for everyone. The coverage is not equal for everyone. So this inhuman system of the healthcare caused the high rate of mortality in low social class because they have to ignore their health and prioritize the other basic more than the medical expense. The other thing that I want to mention is administrative costs contribute to excess U.S. health spending. Abraham says if the United States were to cut the administrative spending to match the Canadian level, the country could save $600 billion in just 1 year. It's a large amount of money. And I was surprised when I see that. It demonstrates the government spent a significant cost for the unnecessary administrative complexity, and they could, if they cut all of these costs, they could cover the majority of uninsured and increase uninsured people and increase the care for the elderly and the disabled people. Now we're done talking about the cause problem, and we want to talk about what is the solution to solve this problem. I believe the only solution that we can do as one of the person who live in the United States is providing the online survey and try to distribute between all of the people to sign in and ask the government to decrease the medical insurance to be affordable for everyone. I think people should start this wave on social media such as Instagram, Facebook, YouTube, Twitter, whatever you think should be helpful to solve this medical problem. Powell said when all of the people have equal chance to go to the hospital, visit the doctor regularly, so we can decrease the mortality rate and they can diagnose their disease before it gets worse. The government also can follow the strategy of the developed countries such as Canada, Netherlands to decrease the administrative costs. In Canada, people can go and visit the doctor, go to the emergency room because the cost is very low, and the medical cost and the drug prescription is very cheap because the government controls all of the insurance facilities. I believe each person responsible to eat the healthy food, do more exercise, and watch their diet because the rate of eating junk food in the United States is significantly high, and because it's cheap and easy to access. I believe each person should start by their own and also teach other people to change their lifestyle and diet and encourage them to care about their body and health. Today I talk about the healthcare system, which is our major issue, and it needs more attention from the government and the people. Today I talk about the cost and inequality service in the medical field and how this unequal allocation of the resource and power it caused the problem for accessing the medical care. I hope one day everyone can access the affordable medical care to have a better life. Thank you.